Did you know that 75% of career failures are attributed to low emotional intelligence? On the other hand, 90% of top performers possess high emotional intelligence. I'm going to talk about emotional intelligence for healthcare leaders. Hi, this is your Priya Physio UK. And before we go ahead, subscribe to my channel on YouTube called Priya Physio UK for in depth interviews and detailed discussions. Right, so let's move to what is emotional intelligence. It consists of four pillars. Number one, it starts with you, self awareness. Number two, self regulation. Number three, social awareness. And number four, relationship management. So, in a sense, emotional intelligence is all about how you manage your emotions and feelings, how you regulate yourself so you're better equipped and socially aware of people around you and how you're impacting them and their emotions. So, why is it important for healthcare leaders to possess emotional intelligence? Number one, it is going to increase your leadership effectiveness with enhanced decision making. The more emotionally intelligent you are, the better you are going to be able to handle others around you and support them. Number two is better stress management. Not only your stress management, but you will be in a position to manage and support stress of others and your teammates. And last but not the least, personal development. The more and more you focus on working on yourself and continuous learning on self awareness and regulation, the more you're going to be there for your team when it comes to supporting them and making a productive team. So, there is a direct correlation between leadership effectiveness and productivity as compared to emotional intelligence. Now, let's see how you can apply this in your daily leadership role or in your daily work life. Very simple. An emotionally intelligent leader is perceived as approachable and visible all the time because you will be there to support your team. Number two is about enhanced team productivity. Your team will feel welcome to come and talk to you if they have any issues. They won't have this feeling of I am going to be judged if I ask this question. And last but not the least is about motivating those around you. So this is and essentially going to increase your team performance. And more productivity, you'll be more visible as a leader in your healthcare organization. So, as you can see, emotional intelligence is very important for any healthcare leader. And if you are working in healthcare settings, you could easily see who is empathetic and who is less empathetic. I'm saying that because when you move into a leadership role from a frontline clinical role, it is quite easy to miss that link because you're not seeing people as often as you would have seen your patients. You all resonate with that, don't you? And this is exactly why it is important for you to remain empathetic and not forget that human touch and the reason that you are there. Anyone who works in healthcare is there only for one reason. We are there for patients. The patient should always be at the heart of everything we do, not just for the sake of putting it as a high value for your trust, not putting it as a selling point in your interview, that you actually are empathetic. And it is not simple. It is very easy to forget when you're looking at numbers. And if your job requires you to talk on evidences and numbers and data and reports, it is very important for any leader, for any healthcare leader to focus on the human or the people connect. Because you are talking about a number and that number is a patient, it's a life. And if you really want to absorb this, one last message from your Priya Physio is don't forget that you are a human being who is there as a leader to support another human being who needs your healthcare services. So be out there as a sponge absorbing all good that is around you and try and filter out anything that you think is going to affect your empathy, your emotional intelligence, or your emotions in one way. This is your Priya Physio UK. Hope you've enjoyed my session. I'll be looking forward to my next series, Healthcare Leadership. I will sign off for now. Bye.